Hi everyone, my name is Shreya Shrinivas. I am currently a final year medical student at the University of Edinburgh and I'll be graduating this summer. I'm here to speak to you a little bit more about my elective experience. I had the chance to spend 6 weeks of my time at the BKL Walawalkar Hospital in Derwan, Maharashtra in a rural setting, and I had a really wonderful time. And I was hoping to talk to you a little bit more about that today. So I spent my 6 weeks rotating through a variety of specialties, and you can always fine tune these to your interests. I started in community medicine, followed by general medicine, general surgery, obs and gynae, and then pediatrics. And I got to see a lot of different presentations, including an animal attack, which is something that I hadn't learned much about, and it was really interesting to learn how that's managed. One of the most useful things was also that I could practice a lot of clinical skills under the supervision of the seniors there, and they were really helpful in terms of giving you tips and advice on how to go about things. So, how can students best prepare themselves before going for their elective? I've come up with a few different points and I've separated these into practical tips and things that might help you enhance your experience a bit more. Coming to the practical tips, I would start by reading the elective guide. It's a really handy booklet that's shared by the organizers and contains a lot of useful information, which is all kind of condensed into one book and is it all in one place, which is quite useful. You can also prepare for the weather. That's a really important one because some of you might go in monsoon, but some of you may also end up there in summer, which is where when I went, and my cotton clothing and multiple bottles of water was what got me through that heat. Rest assured, of course, there's cooling systems in place in both the hospital as well as the accommodation that you'll be staying in. Carry your scrubs, and to add on to that, maybe carry a white coat as well. There are some specialties like obstetrics and gynecology that ask you to wear a white coat over your scrubs, and so that's useful to keep handy. Get your vaccination sorted early. Again, there's a helpful link to this on the elective website, but it's just useful to make sure that you get this done earlier because it varies from country to country. And travel insurance and indemnity cover is another easy thing to kind of get sorted out, but it's worth getting done early just so you have all the formalities in place. So, coming to some of the tips that might help enrich your experience a bit more, I would say start by reading up on the local culture and history. There's a lot to learn about, and it's also a really good starting point in terms of getting to know the local staff and the patients, and it also helps you understand the cultural context a bit better. Stay in touch with your buddy and try and become friends with them. So once you're there, you get assigned a medical student as a buddy, and they're usually someone you'll see in professional and clinical settings. But it's also really nice to be friends with them because they have a lot of great suggestions to make and may even accompany you when you're trying to explore the local area. I would also recommend that you try the local cuisine and visit some of the local attractions. The Konkan area is really lush, especially in the monsoons, and there's a lot of activities that you might want to try, things like hiking, visiting local temples, and I particularly really enjoyed trying the local food and cuisine there. It has really unique flavors and is definitely something that you shouldn't miss out on. Familiarize yourself with some simple words in Hindi and Marathi as well. This will definitely help you get the best out of the patient interactions because these two languages are the main kind of modes of communication, and it'll help you be able to take better histories and communicate better. Duolingo offers really good Hindi language courses, and there's a few Marathi language courses and resources on the internet which might be useful to refer to as well. Try and stay in touch with the staff at the accommodation and hospital as well. They're all really helpful and really kind, and especially when you need to navigate the campus or if you need to find something that you can't get, they're really good people to kind of approach in those situations. Finally, I would also say revisit some of your notes, particularly on topics like tropical diseases like dengue, malaria, and TB. These are extremely common presentations there, and it's not something that you see as often. So I definitely needed a refresher to kind of remind myself of the presentations, and it definitely helps you whilst you're on clinical placements there. So when students arrive, what can they do to contribute? The hospital itself is located within a campus, and this campus is funded by a charitable trust, the SVJCT, and this campus consists of a medical college, a nursing college, a physiotherapy college, a primary and secondary school, sports complex, the hospital itself, and a bunch of housing as well. So there's always somewhere you can get involved, and if that's something you really want to do, there will be people to support you with that, and it's best to directly ask your local supervisor or one of the members of staff who can guide you with this. Things that you could possibly do include volunteering to teach the school children about healthcare topics, getting involved in community outreach through the health camps and home visit programs, the QI project, or you might also want to get involved in some of the health promotion events that the hospital arranges, which are a great way to understand the sociocultural factors that affect patient health. My personal experience was that I went out on an outreach health camp, and this was really great. I learned a lot about common diseases like diabetes and hypertension, and how their complications can present, patient perceptions of healthcare, and how to manage and escalate unwell patients out in the community, and also answer their families' concerns. The hospital. So so here's a few pictures of my time in Deirvan, spending time on clinical placements, going to theater, making new friends, and eating really yummy food, and also going out on home visits to patients' homes. And in my final slide, I'd like to just highlight some key takeaway points. The first is to keep an open mind. The clinical setting is similar, but there's a lot of things that differ, including the patient perceptions of healthcare, which is affected by their socio-economic and cultural backgrounds, and overall how medicine is practiced there as well. You eventually learn to adapt to these differences and come out having learned something completely new, which is a great experience in itself. I would also say that you should let your supervisors know what your learning objectives are, because they can really help facilitate how you can best achieve these goals while still contributing to the community in Deirvan. And so you can make the best out of your elective experience. I'd also like to quickly thank the team in Deirvan, Dr. Suvarna Patil, who was my local supervisor, as well as her team of staff members who were all really lovely and looked after me really well, and Dr. Sanjay Deshpande, who helped me connect with this hospital and the program in the first place. Thank you.